I think even as pharmacists working within health systems, you very quickly encounter difficult questions around, if you have two competing patients who are similarly ill, but you only have one quota of a particular life-saving drug, who do you give it to? How do you make these difficult decisions?
So I guess all the codes of conduct stem from the Declaration of Helsinki and a number of other reports that came out of the product of, I guess, the atrocities from World War II, and it sort of set the minimum standards for ethical research and clinical practice.
I think if you can create that awareness that ethics is not just about a tick box exercise, but is something that we are constantly learning how to manage, and that it's sort of a muscle that you exercise, that you should be reflective, communicate openly with your colleagues, embrace the fact you're not always going to get it right, and be compassionate with your colleagues and realize they're not always going to get it right either.
Diagnosed with Parkinson's disease, which is a largely intractable condition that will ultimately degenerate and get worse. Your ability to really take in that nuanced information is really difficult. So I think that's where clinicians have to have a really nuanced understanding of how they're communicating, make sure that checking to make sure that people understand, talking to their families as well, because it doesn't just affect the individual, it affects their carers, their loved ones, who then might have to deal with those behaviours.
It starts off with perhaps a recognition that the current system that we have for encouraging and rewarding innovation is one that is very much profit first, and as such is for lack of a better term, broken. By delinking, you're essentially taking the cost and the risk of R&D away from the final price of the drug that is set. What's been proposed is that we reward companies through prizes or through one-off payments. I think rather than who leads this conversation, it's useful to look at who's been left out of the conversation traditionally. For most of history, the public has been left out of this conversation.
And the issue of organ transplantation is not just with regards to the ethics, but also with regards to the medical side of things, as well as the law.
People from Indigenous backgrounds who were adamant that their organs should go to people also from Indigenous backgrounds. And there's a very good justification for that. How can a government convey the uncertainties associated with science to the public when doing that may undermine the public health?
I think pandemic preparedness is much more than clinical ethics, and a lot of those decisions also are with regards to public health ethics and the public policies that you make in order to prevent patients from coming into the hospital system in the first place.